So this is our stringer of instruments. This is it on your back table, on your towel. So we're gonna go over how to count them and what they are. So you start off by saying the name and then how many. So we start with mosquitoes. Mosquitoes, 1, 2. Curved criles, 1, 2, 3, 4. Straight crile, 1. Kelly, 1, 2, 3, 4. Peon, 1, 2, 3, 4. Alice, 1, 2, 3, 4. And I'm holding up here, so I'm keeping them organized as I'm going. Because if you let go, they might fall down. So, Alice. And then Babcock, 1, 2, 3, 4. Coker, 1, 2, 3, 4. Tonsil, 1, 2. Right angle, 1, 2. Needle driver, 1, 2, 3. Scissors, 1, 2, 3. Ring forceps, 1, 2, 3. Penetrating towel clamps, 1, 2, 3, 4. Non-penetrating, 1, 2, 3, 4. Alright, so first we have our mosquitoes. These are the smallest ones in our stringer. Yeah. You want to look at the shanks and the jaws whenever you're looking at an instrument because some of them look very similar. So this is a mosquito. Next we have our curved crile. Again, look at the shanks, look at the jaw. This one is the second in our stringer. This is different from the mosquito. So if we look, we can see these jaws are way longer than these ones. These are very tiny compared to these. Then we have a straight crile. Again, you want to look at the shanks, the jaw, look at the tips of the jaw. This is after your curved crile. So this is next. Then we have our Kelly. Again, through all your instruments, you're always looking at the jaws and then the shanks to see because they all look similar. So again, this looks really similar when they're next to each other, like a curved crile. They have the same build, similar build, but one is longer. So crile has shorter shanks, and then the jaw is a little shorter than a Kelly and curves a little bit more. Alright, next we have our peon. See, the first couple ones look very similar. The jaws keep curving. Again, shanks, jaw. This is the peon. Alright, and then we have our Alice. This is not like the past ones. It's not curved. This isn't a clamp. This is for grasping something, grabbing it, but it has teeth on it. So this is an Alice. And there's different sizes. Some of them, there's not in this set, but they could be longer or shorter. You always just look at the teeth and the jaws. Alright, now we have our Babcock. Like I was saying with the Alice, they could come in longer and shorter. They're the same things though. But one's longer, one's shorter. And yet again, just look at the jaws. Okay, next we have our cokers. Again, any of these instruments can be different lengths past the peons and stuff. So these are both cokers. One's shorter, one's longer. Again, you want to look at the jaws and then if there's teeth. Next we have a tonsil. Again, this kind of looks similar to a crile or something, just by the jaws. Like if you just seen these two without the shanks, you'd be like, those are the same thing. No. Look at the shanks. Look how much longer this one is compared to this one. So yeah. Alright, then we have our right angles. These two, they're both right angles. One's a little bit longer, and also this right angle is more defined than this right angle, but they're still both right angles. So yeah, there's the jaws. Alright, next we have needle drivers. The small one though, you always want to use for skin. They all serve the same purpose, driving a needle. This one is more for a fascia because it's bigger and it can hold a bigger suture. So those are your 3 needle drivers. Perfect. Then we have 3 pairs of scissors. You have your curved males, your straight males, and then your mets. So in lab, you literally use your straight males and your mets most often. The straight males are thick and bulky. These are going to be used for cutting sutures. Never skin, just sutures. Then the mets, these are thinner and skinnier. These are used for cutting tissue. These do not cut sutures. This only cuts tissue. These do not cut tissue. These only cut suture. And in all honesty, we haven't really used these much, but these are your curved nails. These are different from your mets. These are thicker. These have a bigger blade. These do not. These are skinnier. So this is our ring forceps. This is probably the longest in this stringer. As a whole on each side. They kind of look like tongs. But yeah, they're the longest. These are for if your surgeon needs a sponge stick. So you put a ray tech on it, and that's what it looks like with the little thingy on it. So yeah, these are ring forceps. Then we have our penetrating towel clamps. This one is sharp and pokey. Then we have non-penetrating towel clamps. So there's two different versions in your stringer. You have this one. It has teeth on it, but it's non-penetrating, so it's not going to poke or cut anything. Then you have the ones with the half circles on them. So these two are non-penetrating.
So these are some of the forceps that we have most commonly used in class. This first one is an Addison with teeth. They're really little, but you'll see the teeth right there. These are pretty common to use when passing with a skin suture. This is a rat tooth forceps. There's two different sizes. These are also used with suture. You pass them at the same time to the surgeon. And then this is a DeBakey. You would most commonly pass this with a Bovie.
So for our retractors, the first ones we have, this is a wheat liner or weedy. This is a self-retaining retractor. So this will hold up on itself and it'll just stay like that. You don't have to hold it. Same thing with the Gelpy, but as you can see, this one has little pointy ends. So just be careful when you're passing this. These are Parker retractors or C retractors. Not to get confused with an Army Navy. They look very similar, but are different in size, just a tad bit. And the Army Navy has this part in it. This is a malleable or a ribbon retractor, mostly used for intestines. It can be moved around. Yeah. This is a Diva retractor. When you hold it up to your arm, it's like a D. Okay, these are the Richardson. This is a double Richardson Eastman, and a Rick. Then we have the bladder blade. That's what it looks like. When you pass it, you will pass it like this, ready to be used. And then this is our Sen retractor, the smallest one out of these retractors. Next we have our Balfour retractors. So the first piece is the longest. Then you're going to add the smaller piece. This will go in on the end. Then you will add the arm. You will add these extensions that the patient needs.
Yeah.
Or a heavier set patient. That's what it'll look like. And then lastly, the bladder blade will go on it. When you put the bladder blade, you just have to make sure this wing nut is loose. Oops. Okay, we also don't have all the pieces to the Balfour, but this screw makes sure that these stay together. And that is the Balfour. Next we have our suction. So in case you have a yank hour and it happens to fall or it gets contaminated, what you can do is grab this suction piece with the small peanut on it and screw that on. There you go. And then next we have our pull suction, which comes in two different pieces. You're going to screw that on. And this one is disposable. It's also counted but disposable. This one you cannot throw away. But those are all of your instruments. You're also going to get a flash drive with all of your instruments on it. Learn it, live by it, love it. Know your instruments. Know what they're for. What else is there? I don't know. This is literally just one set out of many you're going to learn. Study these. If you don't know your instruments, you're not going to be successful in this class. So, get it together.